And we're back on 2nd Street talking about prevention and healthcare. My next guest is going to be telling us a little bit about Alzheimer's and what can be done to help prevent developing that horrible disease. Dr. Roger Wong is a director with the Alzheimer's Society of Canada. Dr. Wong, thanks for taking a few minutes to chat today. I'm wondering if you could maybe just tell us a little bit about the big picture before we dive into this issue. How many people in Canada are actually currently dealing with Alzheimer's or at high risk for developing the disease?
Absolutely. Thank you very much for the opportunity to share some very important information with all Canadians. Dementia is a general term that we use to describing a condition of the brain when there's degeneration in the brain, leading to different difficulties with function. The most common type is Alzheimer's dementia. In Canada, as we speak right now, in 2024, there are more than 730,000 Canadians living with the condition, living with dementia, including Alzheimer's. If nothing were to change, the projection of the number is that in the next 30 years, it would go up to 1.7 million Canadians. Huge numbers from coast to coast to coast. All parts of the country will be affected.
Wow. And what does it look like in terms of the cost to governments when it comes to the healthcare system in helping these patients?
When we think about the cost, we need to remember that they do not only include financial costs. I mean, clearly you could imagine because of the lost abilities to doing things such as in their work, in the occupation, or from a day-to-day living point of view, because of caregiving that needs to be given through care partners, families, friends, neighbors, etc. There are definite financial costs, but let us also remember of the social costs that are involved. The social costs, maybe opportunity costs, other things in terms of day-to-day living. How do each of us function at the optimal way that we want to function is a devastating condition affecting many Canadians and also the care partners. It's never about the persons living with the condition only, but very much about the families and loved ones. Huge numbers, huge costs. All of us must do something now to try to prevent and delay the onset of dementia. And that is possible.
Mm-hmm. That's a very good point that you raised, because it's not just the cost of the system dealing with patients coming in and having to treat them and so forth, but there's also families that are involved, people that maybe have to miss a shift at work because, a loved one is, having some particular issue that they have to go and deal with and that. So that's a very good point. I really enjoy talking about prevention. Your website has a whole bunch of ideas about what can be done to prevent dementia, possibly delay it and so forth. Could you tell us about a few things that you think Canadians need to be mindful of?
Absolutely. The first message I want to share with all Canadians is that please understand you are not alone. There are many of us who will journey with you throughout, whether it is about a person living with dementia, Alzheimer's included, or a care partner, a family, a loved one, because the sense of helplessness can be devastating. Please understand that there is an Alzheimer's Society in every province and territory across Canada. Earlier this year, there was an important study. It was published in England by the Lancet Commission. It talked about there are 14 different things that we can do in order to prevent dementia or at least delay the onset. These things occur throughout the life course, and therefore there is hope. There are things that each and every one of us can do. In fact, of the 14 risk factors, conditions that lead to the development of dementia, therefore potentially preventable, if you do them all, then up to 45%, almost 1 in 2 cases of dementia in general can be prevented, or at least the onset can be delayed. And delaying the onset is really important as well, because given the high numbers that we spoke about, if you can delay the onset by 1 year in Canada in the next 30 years, the number of individuals living with dementia in Canada can reduce by 500,000. That's a significant impact.
Wow, that's huge. I want to unpack these items on the list. We'll dig into them, but let's start off. Was there one in particular that maybe kind of surprised you?
Yeah, I will share with all of you there are 2 new findings amongst these 14, 2 new conditions. One is actually about loss of vision, not able to see things very properly. It's associated with the development of dementia. The other one is about a high level of so-called bad cholesterol, LDL cholesterol level. Now, we know that stroke is one of the causes of dementia, and LDL cholesterol, when elevated, could be associated with a high risk of stroke. But there actually is an independent connection now. Two new things that we have found out.
Okay, when we come back, we'll be talking more about the preventative side related to dementia and Alzheimer's.